morning world. So today's news we are going to talk about the Sputnik-V vaccine. And in this video you will be able to learn about how the vaccine works, the details of the clinical trial conducted, the result of the experiment, and also the implication. So now may we now introduce to you our speaker, Miss DANICA Joyce, ARCE. Take it away, ma'am.
Okay, so let's proceed. I have the notes here answering all your queries and questions. First of all, introducing immune system to inactivated form of the SARS-CoV-2 coronavirus or part of it. This vaccine used two harmless viruses that deliver the genetic code for our cells to make a protein from the coronavirus. This trains the immune system of our body to fight against future injections with the new corona. How the vaccine works. GAM-COVID-VAC is a combined vector vaccine based on rad type 26 or rad26 and rad type 5 or rad5, both of which carry the gene for SARS-CoV-2. The use of two immunizations gives a durable and long-lasting immune response. Although adenoviral vectors might induce immune responses against vector components and attenuate antigen-induced responses, prime-boost heterologous vaccinations with two different vectors allows minimizations of this effect, and it also stimulates rapid onset of protective immunity. Details of the clinical trial conducted. GAMALEA and RCEM did a randomized double-blind placebo-controlled phase 3 trial at 25 hospitals and polyclinics in Moscow, Russia. The vaccine, first dose rad26, second dose rad5 or placebo were administered intramuscularly into the deltoid with a 21-day interval between doses. Both vectors carry the gene for the full-length SARS-CoV-2. Enrolled participants were divided into 4 age strata. First is 18 to 30 years old. Second one is 31 to 40 years old. And 41 to 50 years old. 51 to 60 years old, and last 60 years and above. Vaccine and placebo were developed, manufactured, and stored by GAMALEA and RCEM. During the observation visits, vital signs were assessed in all trial participants, and changes in the participants' condition and well-being compared with the previous visit were recorded. A PCR test was in combination with the clinical examination on previous day of the second dose. For the diagnosis of symptomatic and asymptomatic COVID-19 cases, in the presence of clinical signs of respiratory infection and a positive PCR test, the participant would not be vaccinated with the second dose and was referred to a medical staff for treatment of COVID-19. All participants were given study team contacts at signing of informed consent, and they were also offered electronic diaries to be installed on their smartphones devices to monitor their health status. Clinical trials established that Sputnik-V is safe and efficacious when given intramuscularly in 2 sequential doses. GAMALEA, meanwhile, recently said that Sputnik-V coronavirus vaccine is 95% effective according to a second interim analysis of clinical trial data. Results of the experiment. Our interim results of the phase 3 GAM-COVID-VAC trial shows that the vaccine is 91.6% efficacious against COVID-19 from day 21 after first dose, the day of receiving second dose. Our results also shows that the vaccine was 100% efficacious against severe COVID-19, although this was a secondary outcome, so the results are preliminary. Our results shows that the second components vaccine, COVID-Vac, was able to induce a virus neutralizing humoral response in participants older than 60 years. Furthermore, vaccine efficacy in this group of participants did not differ significantly from the efficacy of the age 18 to 60 years old. Our interim analysis of this phase 3 trial of COVID-Vac has shown promising results. In parallel with implementation of multiple clinical trials, the vaccine has already been released in Russia, and as of January 23, 2021, more than 2 million doses of COVID-Vac have already been administered to the public. Our interim analysis of randomized controlled phase 3 trial of COVID-Vac Russia has shown high efficacy, immunogenicity, and a good tolerability profile in participants aged 18 years old and above. The result shows that the vaccine as well tolerated and highly immunogenic in healthy participants. As a result, the vaccine candidate was provisionally approved in Russia.
Good morning! India said on Wednesday it has found around 40 cases of Delta coronavirus variant carrying a mutation that appears to make it more transmissible. Okay? The variant known as the Delta Plus, and it has been reported in Maharashtra, Kerala, and Madhya Pradesh. And here, what we know about the Delta Plus variant. Delta Plus variant, or AYY, is a further mutation of the known Delta variant B.1.6172, and India's health ministry declared that the Delta Plus a variant of concern as it poses an elevated risk compared to a variant of interest. Delta Plus can cause more harm into what, and also like stronger binding to lung cells and reduction in monoclonal antibody response. What's the update? Scientists are yet to test the effectiveness of vaccine on the Delta variant. And that's the update for today. This is LEAH HANDOC reporting.
This study finding shows that the Russian jab was able to produce protective neutralizing titers against new variants. These include the alpha, beta, gamma, and more importantly the Delta variant, which has been identified as the key drivers of the second wave of COVID-19 infections in India. They also studied that single dose of Sputnik-V vaccine is enough for recovery. COVID-19 patient scientist says that there is no evident benefit of using second dose in previously infected individuals. This vaccine showed 94% among COVID-19 patients has been recovered.
Implication.
CAMLEA and RCEM have not been able to assess duration of protection Median follow time was 48 days after first dose. Although the study enrolled participants with comorbidities, not all risk groups are represented. There is a need to further investigate the vaccine in adolescents and children under pediatric investigation, as well as pregnant and lactating women. Most participants in our trial were white, so we welcome further investigation in a more diverse cohort. Further studies of candidate vaccine are needed to obtain information on duration of post-vaccine protective immune response. Yet, the results on efficacy and safety of COVID-19 vaccine candidates thus far are promising. Been approved in 70 different countries and is being distributed across the globe. It has also come to the aid of several low and middle income countries through the COVAX agreement. This vaccine shows a consistent, strong protective effect across all participant age groups. Being vaccinated using Sputnik may weaken virus to deliver small parts of a pathogen and stimulate an immune system.